Hello, my name is Saskia Scrimshaw. I am a student at Vancouver Island University. I am presenting today a public health inquiry about the health of nurses in the workplace. From a quick Google search, you can see that nurses' health is affected by the conditions that they work in. For my inquiry process, I will start with Canadian sources, including the Canadian Federation of Nurses Unions, or CFNU, and then also Health Canada to understand the current workplace issues. And then I will look at peer-reviewed studies specifically on burnout and musculoskeletal injuries. Across these sources, there's a consistent theme that suggests that nurses' health is strongly shaped by the conditions that they work in. The CFNU survey shows that many nurses reported caring for more patients than they felt they could safely manage. And Canadian nurses were working overtime and in environments that were regularly over capacity. When nurses are consistently stretched beyond safe limits, they may experience exhaustion, moral distress, anxiety, depression, and a reduced ability to recover between shifts. The first issue I want to address is burnout, which research connects with emotional exhaustion, depersonalization, and a reduced sense of professional accomplishment. The same research by Delora et al. Links burnout to exposure to stressful and unsustainable work environments. Burnout is also connected to patient safety. The researchers argue that when nurses are fatigued and overwhelmed, the risk of errors and adverse events increases, which means that supporting nurses' mental and emotional health protects patients as well. The second issue I want to highlight is physical injury. Nursing is physically very demanding work because nurses lift, reposition, transfer patients, stand for long periods, bend, reach, work in awkward positions. Gorse and Jackie Brett 2025 found that nurses experience high rates of work-related musculoskeletal disorders, especially in the lower back, neck, and shoulders, which can lead to chronic pain, fatigue, reduced quality of life, absenteeism, as well as long-term occupational health issues. These issues are urgent because our healthcare system cannot function safely if the people providing care are being physically or mentally injured by the work itself. The studies presented here suggest that improving nurses' health requires workplace-level change. Health Canada recommends flexible scheduling, mental health supports, reduced administrative burden, stronger leadership, and safe staffing ratios. Other research emphasizes the importance of violence prevention policies, clear reporting systems, debriefing, and psychological safety, as well as ergonomic programs and safe patient handling equipment to reduce physical injuries. Because these problems are rooted in the work environment, the recommendations need to focus on organizational change. Nurses need to continue speaking up about unsafe workloads, burnout, violence, and injury, but the burden is on the health authorities and the government of BC to treat nurses' well-being as a safety priority for nurses and for patients. My question for the government of BC is, what concrete action will be taken to ensure safe nurse-patient ratios, safe workplaces, and the physical and psychological support that we need to stay healthy in this profession? Thank you.